folks. Thank you for joining us today for this live webinar. I'll be interviewing one of our graduates that have gone through our training here at ABS. Let me just introduce myself. For those of you who have not been on the webinars before, I'm Patrick Phillips. I'm the founder and the CEO of American Business Systems. We've been doing this for about 26 years now. I am an author. You'll see some of my books out there on Amazon.com and in your local bookstores. One of them on the far right there we're going to be talking about today. That's one of our marketing tools that you can use to market your business. And Daniel will tell you a little bit about that and how he's used that book today as well. I'm on the editorial board of a magazine. Yes, it's still in print and mailed out each month, called Billing and Coding Advantage. Anybody who's anybody in this industry is a subscriber to this magazine. There's over 40,000 subscribers. And again, my articles appear in that magazine on a regular basis. I'm also on the board of directors for MIRMA, which is the organization that we've aligned ourselves with as a company to train you and to certify you once you've completed the training as a medical revenue manager. So you can find out more about that out there on the web at mirma.org. So if you're wondering what we do, and if you've not been on one of these webinars, we basically set people up in doing medical billing. Most of them work from their home, although many of them have opened up offices as they've grown. We're using a cloud-based system, so there's no software that you have to worry about. You could literally go to Best Buy and buy a brand new computer. I'm assuming you could get into a Best Buy right now and bring that home, bring it to a McDonald's or anywhere that has a Wi-Fi connection, even a tire store, for example. Just hook it up, turn it on, and you'd be able to log in and start running your business from anywhere in the world that has an internet connection. Our system is a complete system that includes practice management. That's what you would do to the billing within. We have an electronic medical record system for doctors to use that they can use on their iPad or tablet. We have our own clearinghouse that's built in. That's why our rejection rate is less than 2% on our initial claims that go through it. And we have a patient portal. Yes, it has telehealth built into it, which we'll talk a little bit about today as well. We also have several other services, ancillary services we call them, that you as a licensee can offer. And all of this is offered as a license, just like a franchise. We have a license fee of about $28,000, but it includes all of these services. There's nothing extra you have to buy, no extra fees you ever have to pay us. That's a one-time fee to go through our training, get certified, get all of our help, our lifetime support, our ongoing training, et cetera, et cetera. Folks, we have people from every background that you can imagine, from coast to coast, that I've done interviews with. You can go out on our YouTube channel and find out more about that. So let's get Daniel on the line here today. Daniel, I'm going to pause my screen here just so I can make sure that I'm actually seeing you on the webinar video webcam here. There he is. Hi, Daniel.
Hi, Patrick.
And Daniel's not working from his home today, is he?
No, Daniel's not. So Daniel's actually working from a tire store today, and show you I was on my way from a client meeting, actually heading home, and got a flat tire on the side of the freeway. So I'm doing this webinar live from the tire store. I do have my mask for COVID-19, and I'm kind of tucked into a corner here. So hopefully it's
you're socially distancing yourself.
I'm socially distancing myself, yeah.
Well, it's nice to have tools like, obviously you have an iPad. I see you're using your AirPods. It's easy to run a business from anywhere nowadays, isn't it?
It really is. It really is. And especially, given the cloud-based system that you referred to a little bit ago, I mean, it's frequently that my wife will be doing some of the coding or billing and things like that while we're, driving in the car, and, check right away with clients. So it works good.
Your wife actually works in the business full-time as well.
Yes, she does. My wife and I are both full-time in the business.
Yeah. All right, so we just ran across this out on Fox Business website, and one of my guys sent it to me just about 4 hours ago. It says, recession has hit America's healthcare industry, and it's brutal. Yeah. Here's what needs to happen now. Now, Daniel, you can tell us, about your experience out there in the marketplace right now, but this says that the healthcare sector is in recession. Hospitals, physicians, dental practices, and laboratories are hemorrhaging money and furloughing staff. Some are on the brink of bankruptcy. Isn't that great news?
It is. I say that there's a whole new fruit tree out there to pick, and it's not lemons. You know, there's a
I like
lot of opportunity. Because there's a lot of you know, look, everybody thought, oh, with COVID, you know, 19, and the doctors would be really, you know, raking in the money, but that's not what's happening. You know, several things have occurred. Number one, of course, is that elective procedures and things like this, or non-critical procedures, are being postponed. But the other is that, you know, doctors are finding out that their billing is really messed up because the people can't physically come to the office to actually do the work. And you know, so this is a huge opportunity for us, because there's an awakening right now that's happening about you know, utilizing technology such as telehealth, utilizing cloud-based billing systems, utilizing outside help that is not dependent upon being in their office. And even helping them to drive patients through telehealth is a huge part of that.
Yeah, and you know, that's basically the basis of our business, isn't it? That's what we do. You, as a licensee of ABS, you're actually helping doctors with their cash flow revenue problems that they're having, and this is a big time for them to have a lot of problems, isn't it?
Yeah, it absolutely is. Absolutely is. I mean, we had a client that we put onto telehealth, and compared to their peers, so they, because they were set up already with video and everything that we had, so compared to their peers around them, they did much better. They weathered this pandemic much better so far, because they've been able to keep their billing rates up, because they have a HIPAA compliant, which is, you know, that's really important too. It's not just, you know, we didn't put them onto Zoom, which we all know is having lots of problems nowadays. You know, it's a HIPAA compliant, secure patient communication. So they're able to, you know, they've been able to keep their billing rates up, and they've been very appreciative of that. It's been good for us too.
Daniel, why don't you tell us a little bit about your background when you were looking into getting this business started? What were you doing?
Well, I've been an executive, senior executive of several different companies in the energy sector, and I was the CEO of a company when I decided to join into ABS and become part of the ABS family, and really because I was traveling all over the world, and I was, you know, I spent so many days in airplanes and different countries, and it was just, you know, I have a little bit of a baby face, but I'm, you know, 50 years old, and it was just wearing on me. Spending so many you know, miles on the airplanes and out of the country, and in some pretty rough areas too. I mean, you know, and I got to do something where I can be at home, spend more time with my family. I have two young children, a 2-year-old and a 4-year-old. And I was talking to what got me to think about this is I was actually talking to my next door neighbor, who was an eye surgeon, and we were talking, and he was just telling me about all of the mess in the billing, in all of the problems and challenges that he had. And as we were having that discussion, I got to thinking about this and started doing some research. And then one day I came back to him and I said, you know, I was thinking about, you know, looking into this medical billing business. And it was interesting. He told me that another friend of his, which was a physician, left being a physician and went into the revenue management side of the business because he could make more money and work less doing that than he could, you know, actually being a physician. So he closed his practice and went a different direction. So you know, that's what started my due diligence.
Because most doctors don't want to, you know, get out of medicine.
Well, most of them are terrible business people, to be honest with you.
That's
so,
a fact.
You know,
Yeah.
yeah. And they don't, and that's okay. Like, I'm not, you know, look, they went to medical school. I'd be a horrible doctor. So, you know,
Right.
it's, but you know, some have, and that's what got me started into looking into this.
Yeah.
I was really looking for something I could do and not have to travel around the world.
Now, this was back the latter part of last year, right? When you first looked at us?
We first looked at you at ABS and becoming a licensee. I would say it was in early to mid spring of 2019. And
okay, in the spring, yeah. Because I knew you went through the training, what, in October or something last year?
Yeah, actually, right before Thanksgiving.
Ah.
And so, you know, we relocated. So that was one of the reasons that we waited from the time that we were thinking about this. We were living in Kentucky at the time, and we relocated back out to Southern California, where I'm from originally. And so coming out here, you know, that whole transition, it's not a good time to start a business when you're moving and, you know, dealing with all of that. So we moved and then got back connected, and yeah, we went through the training. I think it was actually the week before Thanksgiving.
Oh, wow. So did you actually get out and do any marketing then at the end of the year? Was it bad timing there
Well,
around
a little bit. I mean, we started, you know, so we went through the training, and then sort of between Thanksgiving and Christmas we were doing some marketing, but it was really more getting our feet wet, setting up, you know, I mean, just things that you'd sometimes don't think about, right? Setting up our CRM system and kind of getting ourselves prepared. And we did a little bit of marketing. We had some doctors say, you know, come contact me after the Christmas holiday.
Yeah.
So it wasn't really until January that we really got going.
And then wasn't it March that the COVID hit?
Yeah, it was March that the COVID hit. But you know, we did a lot in January and February. We signed up our first client. We've got you know, several in the pipeline that we're even still dealing with now. Even with COVID, you know, we've had to shift a little bit in terms of how we do meetings. We do a lot of video conferences and things. But yeah, I mean, right out of the box, it didn't take us very long. We signed up our first client, whom I met through a friend of mine that's a real estate agent.
Oh, cool. Well, so warm market. That's one of the things we teach,
Yeah.
is connect with people who know other people, and they just knew a doctor, this person.
He was selling I was having lunch with him. He's a friend of mine. He's a real estate agent. We were having lunch together, and he was just selling a doctor's home, which I didn't know about that. But I was talking to him, and he asked, you know, what I was doing, and I told him what I was doing in the medical billing. And he said, well, you know, I'm actually selling a home for a doctor right now. And he made the connection.
Yeah, a real estate agent. You know, people don't realize that there are a lot of people out there that once you tell them what you do and can do for doctors, they'll share that with you, and there's your first client. Now, this client was what type of doctor?
So it's a kind of a hybrid. It's a primary care, but they also have urgent care. They've got X-ray facilities. They have some cosmetic. So it's a little bit of a hybrid, but it's primary care based.
Yeah. Okay. Good. And so when did you start actually taking over their billing?
So we took over their billing I'd say about 2 months ago, right in the middle of, or I guess when the pandemic was really getting going. And we took over their billing, but it also led to something else. And this is one of the things that attracted me to ABS, is that, you know, you can kind of tune your business, that what works for you. Turns out that doctor, when the pandemic hit, they asked us to engage and help them from a marketing perspective on social media channels to drive patients to them, because otherwise they would, you know, lose a lot of business. And since we had already had them set up for telemedicine, we already had them set up for all the HIPAA compliant video, you know, services for seeing patients. We started taking over their social media channels, and we really worked hard to drive patients to them. And my wife and I actually had lunch with the doctor yesterday, and he said I guess their search results are up over 600% with Google. So he's super happy.
Wow.
Super happy. And not only, and they've been converting those people to patients, to have a relationship with their doctor. But in the COVID-19 era, they also love technology that allows them to do things like we're doing right now, which is talk on a video. And since we already had all of that set for them, it made it very easy for them to convert new patients, because those patients could see them without having to go to the office and, you know, wear masks and expose themselves. You know?
Yeah. Now, this doctor, like you said, you started the billing in like March or something like that.
Yeah, around that.
Have they seen a difference between what they were collecting from their previous billing situation?
Yeah, so they're collecting. Yeah, they were outsourcing it, and they were outsourcing it to a foreign group. We switched their EHR platform, so we put them on EMRX, and we put them on iClaim. So we took over their entire system and, you know, switched that over. But they're up about 30% now. So they're very, very happy. Yeah, there you go, iClaim. They're super happy because they're up about 30%. And we also found a whole bunch of accounts receivable or rejected claims that were just sort of sitting in the pile that they didn't have any view into. Their biller was in India, and they didn't have any view into what was going on. We've now uncovered that, and we're starting the process of going back and collecting that for them.
Sometimes you can lose a lot of dollars stumbling over the pennies, and that's
Yeah.
what doctors do. You mentioned earlier that they're not the best business people in the world.
Not all of them. I mean, I've met some that are pretty sharp, but from a business perspective, look, they went to medical school, so they're trained as physicians. They're not trained to understand all of this paperwork and the complexities of coding and all of these things. So look, he thought he was getting a great deal with an Indian biller. He had a flat rate. Our fees are substantially higher. Actually, we didn't go in on a price point and try to undercut an Indian biller. What we went in is from a value proposition and said, listen, you're gonna pay us more, but we're going to increase your revenue because we're going to get rid of these rejections. We're going to put you on a better platform. And that everything we've told them has held true. In fact, they have a physician's assistant there that is just tickled. He uses an iPad. He says, man, he says, at the end of the day, he was having to basically go in at the end of the day and code all of these things and write, do all the paperwork after the fact. Now he's doing it in real time on the iPad. He says, I can see more patients and still go home earlier or on time than where before he was working overtime and seeing less patients. So
it's a win-win.
It's a win-win. Yeah. So it was really about a value proposition. And when we thought they were going to be quite a small client because they have a big cash basis in their practice. And so they have what's called concierge medicine or direct provider care. And so we expected them, we weren't touching that side of the business. But point in fact, now they're asking us to help them in that side of the business. And the revenue off of this client is much more than I had anticipated. I thought they were going to be, well, it's our first client and it'll be fine. And, we'll learn from here. Well, we have learned, but we've also learned with a very healthy income stream as well. So it's really good.
Yeah, you mentioned earlier, Daniel, that they had seen an increase in about like 30% or something like that.
Right.
But that means, of course, more money for you. So, like you said earlier, this other company was charging a flat rate. They don't have any incentive to collect any more.
That's right. I mean, and the guy was in India. You get a rejected claim. He doesn't know what's going on. He's not staying up all night to call, during the U.S. daylight hours. So he didn't have any incentive to do it. And we see some that are out there on a percentage basis where they would have some incentive, but they also, then you got to get into, do they have the tools to do it? And so it's a combination of things. It's using technology in the appropriate way, and it's reducing all of the mistakes on the front end, as well as doing the cleanup work from who we came in behind. But we're, even in COVID-19, we're still marketing. We're out there. We're talking with doctors. We've got a lot of clients in the pipeline. And I think we've got another one that is a dermatologist. We've got an orthopedic group, a gastro. So there's a lot in our pipeline, and we had to figure out the new marketing paths with COVID-19. But we've done that. So
yeah. Well, I know that you're using our book, The New Thriving Medical Practice, because there's a copy right there with your name on the front cover.
Right. I've actually got one. I don't know if you all can see, but I've got one right here in my hand, and there's my name right on it. So you can see that. But yeah,
I have that with you at the tire store.
Well, I keep them with me in the car. I have a few of them in the car because you never know who you're going to see, and so since I was, knew I was going to be on this call, I'll grab one and bring it in. But this book actually has been a great tool because I sent this book to an orthopedic surgeon who called me and read the book, and we've got we're waiting a little bit of time for on the COVID situation before we're going to go do a presentation. But I also had we had a gastro as well call me, a gastroenterologist because of this book, and then also sent it to a dermatologist who's looking to grow his practice. And we went down and had he called us, or his office administrator called us, and we went down and had a face-to-face with our masks on, and it was on a Saturday, because they wanted to, not have the patients exposed or us exposed to the patients and so forth with the virus. But yeah, so we're making headway, and it's just changed the dynamic a little bit in terms of how you market. And fortunately, ABS was ahead of the curve, not knowing, of course, that there was a pandemic coming, but in providing multiple tools, different ways, different paths to marketing. And so this book has been really good for us, because you have to nowadays get yourself invited into their space, where 3 months ago you could just walk in the door and start talking to them. Now it's a little bit more that you have to get invited into their space.
Yeah, so you said that you had just basically mailed the book out to 2 or 3 doctors with a handwritten note.
Yeah, that's what I did. So let's talk about the dermatologist. I had never met him before. I saw online, I was doing a little research. I found this dermatologist and looked at their website, and I happened to see that they were hiring for somebody to do inside billing. And so I thought, okay. So I took out my book and put a little handwritten note in there and stuck it in an envelope and sent it to him. And a couple months went by, because I did it pretty early. I would think it was before the pandemic. But once the pandemic hit, I think, there's a realization now with these doctors, like, oh, well, geez, my billing staff can't come into the office. I'm losing patients. There's all of a sudden a realization that there's trouble, and they need help. And so, yeah, they called, and we went down and had a meeting, and so we're working through that process now.
Yeah. So basically, what you do is you adapt. Like you said, this is just a different fruit tree, and you just adapt to the times. It's all about timing, and you just picked a bad time from most business standpoint, but you just took it and ran with it with one of the tools that we provide, and just mailed it out. I think that's great. Did they call you up then and just say, hey, I read part of your book? And
They did. Yeah. So I had highlighted some things in the book, put a handwritten note, highlighted a few sections, and I put couple little markers there for them. These doctors are pretty busy, so for them to sit down and read a whole book is a challenge. So I pointed them right to a couple of things, and it speaks right to what is going on with them right now. Like, that, hey, now's not a good time to be struggling with your billing and having claims rejected and things like that. But also, I think, Patrick, it's my sense, and I've been hearing this over and over as we've been talking with doctors, that we're going to see an uptick. I mean, there may be a recession, as they say in medical, but it's caused because of the pandemic. But now what's happening is doctors are eager, and they're telling us they're eager to sort of make up for that revenue in the latter half of the year. They want to, as things are opening up and sort of returning to whatever the new normal is, electives or surgeries or different procedures, doctors can see patients in the office again. And so now they're really wanting to hit that gas pedal and try to make up for the 2 or 3 months of income that they've suffered a loss on. And so we're actually seeing I think we're going to see a big growth spurt, and I think we're going to see a lot of changes. I mean, there's a reality now. We have some really good tools to offer to these doctors in terms of, telehealth, which, I don't want people to get the idea that that's a phone call. This is, a video just like we have here that's HIPAA compliant and works within their system. And, it's not subject to Zoom bombing and all of these other things that we see out there. So it's a really, and they need these things. There's now a realization that, I'm sitting in a tire store talking to you, and I don't know how many people are on this call. Well, it's the same thing. The doctors can talk to their patients. They can even do, remote diagnostics and things like this, clinical work. So it's really, that's where they realized. I mean, the world was going there, and I think it probably would have taken us, 5 to 10 years. I think it's now going to take 2 to 5 years because, um, there's a realization now that these tools are needed and they exist.
Yeah, there's no doubt that telehealth is the future right now for a lot of doctors because they can actually make some decent revenue on certain visits, and they can even
Yeah,
have an NP or some assistant, a physician's assistant, even doing those calls and reporting back to the doctor on that, and still bill for it. So
right,
yeah, it can
right.
be very profitable
Yeah.
for them.
And we see it as a screening tool, frankly. So I know, for example, Dr. Rawson, the way he's using it, that's exactly what they're doing. So they have a physician's assistant that is sort of screening out, okay, who they're getting paid, but who needs to come into the office and who can they deal with by sending an e-script or something like that. So
Yeah. Tell us about this. This is your first biggest client, of course, and the one that you just kind of had a referral from a friend to.
yeah.
So has that been able to help support you and Josie? I mean, you don't have to give me details about your income or anything, but give people a feel for that client. Is that you see a return on
Well,
your investment with us through
pretty
that client?
quickly. Pretty quickly.
Yeah.
I would say, we just put a check in the bank yesterday. This particular client, still sends out paper checks. Some don't, some don't, some do it other ways. But uh, yeah, it's. I mean, what we thought was going to be a really small client, and frankly, the physician said that too. He said to me when I first talked to him, he said, "Well, I got a lot of cash pay. I don't want you to touch that. It's probably not worth your time." I said, "Oh, let me take a look at it anyway." Um, now it's above average. I mean, it's enough that we're not struggling with mortgage or anything. I can tell you that. So
That's fantastic with one client. And of course, like you said, you have 3 or 4 others that you're working with right now. So I can see it being just a matter of time when you have basically replaced both of your incomes. And so,
yeah, I mean, we're expecting that. Frankly, we're getting ready to start signing up some more clients, given where everything is, and as everybody kind of comes out of the shock of the pandemic. And
sure.
they're in the pipeline, and frankly, Josie was just saying the other day, based upon what we have in our pipeline and things, she said, we might be hiring somebody before the end of the year. So and we kind of do have that perspective. I mean, the orthopedic group that we're talking to has 9 surgeons, and we've
Wow.
had a lot of discussion with them, and it's just we're a little bit slowed just because we've got to do some in-person presentations, which are coming now that things are starting to loosen up.
Yeah. One of the attendees here has typed in, this is ready, says, as someone with interest in setting up this business, one of my concerns is not finding practices. Can you address that concern? Are there plenty of doctors out there that you think that need your help?
Oh my gosh. you know, that's been the least of our problems, actually, is not finding practices. There's a lot of medical practices, and you have to sort of decide, I think, kind of what you want to go after a little bit, like for you don't want to be a jack of all trades. So we're sort of fine tuning ourselves. Like, I think that, you know, so like, well, I've met other licensees, they specialize in podiatry, or they specialize in orthopedics, or they specialize in dermatology. And, we're probably going to end up going that way. I've got, for example, with the dermatologist, I mean, we're kind of comfortable there because the primary care facility is doing a lot of dermatology work as it is. So we have some experience there. When we moved from Kentucky, I can tell you, in Lexington, Kentucky, there was a lot of doctors. I know exactly where they are. And I was thinking about doing that there, but we decided to move to California. But no, in fact, let me just say, I think a good way to position it is this. We are talking with a hospital network right now that is affiliated with the practice that we implemented, TMG. And they're looking to potentially roll some of our services out, and they're talking about 25 practices.
Oh,
But in
wow.
their network, think she said there's something like 9,000 providers in their network. Now we're in Southern California, and they're just in one section of Southern California, so that kind of gives you an idea. But I think even in smaller markets, there's a lot of opportunity.
Yeah, and I hope I'm saying your name right, Red Eye. I want you to know that you've heard Daniel say how he got his first client, but there's about a dozen different ways that we teach how to go out and market. And
Right.
you just try one. If it doesn't work, you try another. I mean, I don't know of any licensees that couldn't sign up a doctor trying at least one of the methods that we teach. We've proven that over the last 26 years, and we have a money back guarantee, so you can't really go wrong trying to get the business started. If it doesn't work for you, it doesn't work. So you just ask for your money back.
Well, I
I don't
think
think
that
you.
the support was great. That's one of the things that I think, look, when you come in, first, not just the training, but when we were first going through and we were doing our work with the first client, and helping them through doing a practice analysis and so forth. We had a lot of help from ABS, and so it made us very confident in what we were doing. So I don't think that finding practices out there is a problem as long as you follow the process. When I will say one thing, when I got into this, so a friend of mine that he owns a bunch of El Pollo Locos, and so I don't know if they have those down there, but it's a franchise, and it's for like a McDonald's or something, but it's KFC, I guess, kind of more like that. And
Oh
he
yeah.
just told me, he said, whenever you're getting into something where you have a business model that's been done for 26 or 27 years, such as ABS, just follow the process. Don't change the process.
Yeah, yeah.
You can evolve it and adapt to things on there, but just follow the process. And that's what we did. We learned, how to do this, and we just followed the process. And so, the tools that are given to us work extremely well. And then the support, helping us get that first client and understanding the data that we were looking at was very, very helpful.
Yeah, and Daniel, you mentioned to me when we were talking earlier before the webinar started that you had a client who was on one of our other services that we have called let's see, was it Choice Pay? I think.
Choice Pay, yeah, Choice Pay,
Yeah.
yeah.
Can you tell people a little bit about that and how that works?
Yeah, so we have, in this case, it's a client that has a lot of credit card, a lot of cash pay. They're doing elective procedures that are not always covered by insurance, so they have a lot of cash pay. And so while it wasn't anything that we could help them with from an insurance billing perspective, I come to find out this doctor was using I think it was Square for their credit card processing, which is the fees are pretty high. And I just happened to notice it when I was there for a visit, and I said, "Hey, can I talk to you about your credit card fees?" And that's where the conversation started.
Oh yeah, anything that save them some money on those merchant
Right.
fees. I pay a
And
lot of
that,
money to the merchant
yeah,
fees.
and that's passive income for us because we're not doing anything. Once we set them up, you know, they just run their normal course of business, and for us, checks show up.
Right, it's mailbox money.
Mailbox money. That's right.
Yeah, and of course, all those services are optional. You don't have to offer any of them if you don't want to, but they're there. They're an extra value to the doctor, and sometimes it gets you in the door to talk to them about something that they're not interested in the billing right now.
Right. Right. And that's the thing. This is not about, people talk about medical billing, and I never really heard the term of revenue management until I came across the ABS. Billing is one component, but there's all sorts of things. There's the EMRX, which helps them, from the clinical side. There's the iClaim, which helps them from the practice management side. There's, we're about to put a client onto CodeWrite because their coding has been a little bit, they've been undercoding, overcoding, and having some challenges there. There's iDocs now. I mean, how many times have you walked into a doctor's office in your life, and you may not know what you're looking at, but look behind the counter, you see all those paper charts up there. There's just no reason for it today to have that. And
No.
these doctors are, they have, public storage facilities full of paperwork that they could get rid of. So there's, and so you can come from a lot of different angles, and not every doctor needs every service. And so, you can kind of pick and choose based upon what the needs are of that client.
Yeah, it all depends on whether they have a need. And by the way, that's how we came up with all these other services. The licensees would come to us every once in a while and say, hey, we got this doctor who needs this. And so we just basically, put the service together and started offering it. And sure enough, a lot of doctors need those services.
Right, right. Well, in fact, it's just like the telehealth. So, you know, through our legacy systems that we have, right? We have, I think it's on the iClaim platform. We had the video medicine built in, so we're able to do that. But we've had some doctors that called in a panic because they were on a different system that didn't have these capabilities, and ABS was able to get us, connected immediately with, a bolt-on function, so they could get into the video business or video, health during the pandemic. So there's, different doctors need different things, and it's not a one size fits all. You have to really go out there and understand their business a little bit. But we have many different tools in our toolbox, which is really nice because, they might say, well, geez, I don't need the sausage, but I'll take the ham over there,
Right, exactly. Yeah. Now, I've got a lot of questions here from Veronica. Veronica, I'm not sure that I understand your first question there. That was pretty lengthy. That may be something we need to get back with you one-on-one on. But one of the things she asks, Daniel, is how much money is needed per month? In other words, are you spending a lot on marketing or anything else monthly?
No, definitely not. I mean, you can spend a lot on marketing if you want to. That's your choice. And if you want to, go run a bunch of Google ads or whatever, you can certainly spend a lot of money. But, we have set ourselves on a pretty tight budget. We're not, we wanted to get out there and see how this would work from our own kind of, sweat equity, if you will, and work it. And I would say, total marketing dollars, geez, I'd be surprised if it's $1,000 right now. I mean, because it's really, I mean, how much does it cost to mail out the book? And we get these books really, really at a great price. So that's not very costly. And I think it cost me about $2 or something to send it. And when you're going out, and even when you're doing other approaches, I would say, we send out some different letters. We have some, I think we do a little Facebook advertising, but it's very targeted. So definitely no, that we definitely don't. But you can if you want to, I guess.
Yeah, I don't know of a lot of expenses that most licensees don't spend a lot of money on that kind of thing. Like you said, you mail out a book here and there, you might spend $100 on postage and envelopes and the books themselves. You
Right.
could send out 20 books probably for under $100. So it's not
Yeah.
really expensive at all. Hey, by the way, one of the questions here is, can you, this is from Madan says, can you please tell me, for a person who has no medical background, how difficult or easy would it be, to sign up with the first client after the training? Did you have any background at all in this industry?
The only background I had was breaking both arms in a biking accident and going through surgery myself. I've been a patient in the hospital. No, look, I really didn't know anything about. I mean, I'm an engineer. That's my background. I'm a mechanical engineer. My wife's education is in communications, and so her background is marketing. My background is in engineering and energy sector. Neither one of us had any idea from, and my wife is an immigrant to the United States as well. So she really didn't understand the U.S. billing side of this, but we, no, I mean, I don't want to say it's the easiest. It's not like, baking chocolate chip cookies or something, but so there's a challenge to it. I mean, you have to commit yourself.
Sure.
But it's not, no, I mean, it's not that challenging. I mean, I've done a lot worse in my life. So I don't want to give people the impression that you just, show up and the client loves you and that's that. It doesn't work that way. But if you follow the tools, follow the process, you use the tools that are provided, and you dedicate yourself to learn a little bit. It's not rocket science, that's for sure.
Yeah. Now, Daniel, you went through our online virtual training one-on-one with an instructor. Is that right?
Yeah, and actually, to be honest with you, Patrick, that's one of the things that we attracted us to ABS, because originally, when we first looked at ABS, we were still doing only the in-person training, and we were trying to figure out, like, oh, how are we going to both fly down to Texas, because we have two little kids, 2-year-old and a 4-year-old, and we're trying to figure that out. But in the months that, when we moved, and out to California, then the online training started, and that was really fantastic for us, because we could both spend time at home, and saved us the travel and the hotel and all that stuff. And especially nowadays, now I wouldn't want to get on an airplane right now. I
No.
mean, give it a little time, but not right now. So I think that was really good. And for us, it was helpful, because when you're doing the online training, I actually found it better, because I was, it's like this, you got a video, you're talking to people, you can, but we could make a lot of, it was very helpful, because we could make a lot of notes. We could do things on our own computer, sitting at our own desk while we're doing it, and you could immediately sort of try some of those activities. So I think for us it was better. It's probably not for everybody, but for us it was.
Our last live training session was last July, and people say, well, what insight did you have that we were going to have this pandemic and move to virtual online training? I go, it was just the timing, just happened to be just right. We just decided at some point that the future was that people did not want to travel, spend a week at a hotel, amongst other people. They just wanted to get the learning done. And so we came up with our online modules now. And kind of share with us, what was I haven't asked you this, Daniel, so I may be embarrassed asking, but what was the experience like with a live instructor?
Well, actually, I thought it was really good. Here's the thing. I think nowadays, for me, it was better, because I was so burned out on travel. That's what attracted me to this business to begin with, was I was so burned out on travel. I have more flight miles than probably a lot of pilots, to be honest with you. And it was just really wearing on me, and so for me, I thought it was really, really good, but not just from the convenience side of it. The training was excellent. Cynthia did a fantastic job, really helped us to understand what we were looking at. And I think at first, like any new business or any new endeavor that you go for, I'd say, first couple of training sessions, we were sort of like, oh, wow, what did we get into? Because it's drinking from the fire hose. But then it all sort of starts to tie together. Your brain starts to absorb it. I found it very, very helpful. And just like we're doing now, there's no need anymore to, have to travel and do training. In fact, I think it was better, because it was one-on-one. It wasn't in a big group.
Yeah, and you can schedule that according to your schedule, right? When you want to have the training done. Yeah.
That's right. That's right.
Well,
and we kind of hurried her up a little bit, because we said, "Oh, Thanksgiving's coming. Can you speed up?"
Oh, that's right. You did it in October, didn't you?
Yeah.
Well, I personally think I would like it better, because you have that one-on-one time with the instructor. You can ask all the questions you want. You don't have to worry about questions from other people that might not even be something you want to hear, so.
Right. That's right. And I think too, for us, when you travel and you do sort of these things, and you're in a bigger group, and I mean, I'm not down on that, because I've loved my life when I was traveling to some extent. But the problem there too, you're really beat by the end, because you're going, you go out, you tend to go out to dinners and things like that. Versus this, when we would learn it, and then we would literally sit right there that same day and start implementing. And so it was much more efficient, because we're like, oh, geez, we didn't think, I guess we do need to set up the bank account. We do need to do this. We do need to do that. Things that you don't really think about. We do need to apply for a business license. And so we could literally get off of the training calls, or the training sessions, and immediately start doing those things that we needed to do. So it actually made it much more efficient.
Yeah, that makes a lot of sense. Um, let's see, Daniel, you have some plans, I think, to try to build this thing pretty big, it sounds like. If you did close, let's say, even half of the doctors that you're talking to right now, what would that do to your business?
Well, I can tell you that. So, as a senior level executive, a CEO, and it wasn't a huge company, but I have grown companies from garages to over 1,100 people. Um, I have a pretty good expectation of where I want to go from an income perspective, and this is achievable because this is what. So, before we got into this business, we looked at a lot of different things. I mean, everything from sandwich shops to I don't know what all I looked at, but I looked at a lot of different, sort of brick and mortar franchises. What I liked about this is it was scalable. I could do it without having to invest in a bunch of real estate or brick and mortar assets, which I'm really glad I, did because right now, it's a tough time. And it's really scalable. It sort of has a situation where once you get one client, then that begets another client. This hospital network I'm talking about, that came through our first client. That's exactly how we got to that
Oh,
hospital
really?
network.
So it was a referral from your first client then, yeah.
Exactly. And so one client begets another client, begets another client. So really the heavy lifting is sort of done in the first year. And then after that, it sort of becomes a little bit of viral. And that's what we're seeing that already, even during COVID. I had my first client. He had another doctor call me. That's she's says, hey, I heard you can help me out here. And so that's what we're finding is there's a lot of virality to the business.
Yeah, and that's a good point. You as a CEO, of course, you were used to probably a six-figure income. This one has the potential for some people to get to even seven-figure revenues. We
No
interviewed a
doubt.
licensee the other day that said we're there. This couple said we will do 1.1 million, or did last year. So
Yeah, there's no doubt about that. I mean, I would say, we may end up at a six figure by the end of this year anyway. But given the COVID situation, I'm not really sure yet. I have to just kind of see how that, I can't predict what's happening with the pandemic, but
yeah,
but the opportunity is certainly there. There's no question about that. And our first, as we're starting to see the checks come in from TMG, those checks are going up, not down.
that's good. Well, you're collecting more money for them, and that's the great thing is that the more money they make, the more money you make. It's a partnership, really.
That's right. It really is. Yeah. Yeah.
Uh, Now, you had access, of course, after you completed the training to our support site, Daniel. Can you give people a feel for what this website here has on it?
Oh my gosh, there's so much in there. There's, I was looking at doing a marketing push. I wanted to send out some letters about, you know, some of the different services we offer. I found letters in there. I found all kinds of articles and resources. There's articles that direct me right to things. I had one doctor was telling me, oh, the chances of me getting audited by HIPAA, I mean, I'm not really worried about it, this and that. And so then I found through this the HIPAA wall of shame, and I, was able to dig that out, and I handed it to him, and he was kind of like, well, but so there's a lot of great stuff in there. There's a lot of great articles, educational tools. It's really an amazing site, and I mean, I could spend days and days and days pouring through that, pulling information.
Yeah, I tell people that there's over 50 hours of training here. I'll bet it's closer to 100. I just really haven't actually counted the hours, but we've got, well, as you can see here on this news page, you can see the archives over here. This goes back to 2014. So there's every month that we've archived all the articles and the news items and videos and webinars and so forth. There's a lot there. It's a
Yeah,
good resource.
we use it a lot, and also there's other tools, little groups that the different licensees are involved in through MIRMA and things that we exchange ideas.
Yeah.
But sometimes doctors will ask us something that I'm not sure. Well, I usually can find it here. If I can't find it here, then I can go to ABS support. But there's two ways to do this, right? I can go out and try to learn all of this on my own and spend the next 6 years, trying to research all of these different things, or I can go to the support site, which has already, everything's there. So I just have to go through and find what I'm looking for, and it's all broken down very neatly and orderly. So it's very helpful for me.
Yeah, you mentioned one of the groups that's out there, of course, is our Facebook group. It's
Right,
just
yeah.
for our licensees. It's a private group. You have to be, invited to it, of course. But once you've gone through our training, you can have access to everything that's on here. And this is where the licensees really start connecting with each other. We announce all of our new webinars and new products and services that we offer to licensees right here on this site. So, folks, this right here alone is worth the license fee. And somebody asked a while ago what the training costs. Folks, this is like a franchise. It's got a license fee of $28,000. And Daniel, give us a feel for the value you think that's in this business for an investment of $28,000. That's not a lot nowadays, is it?
No, looking around, I mean, you could spend a lot more to do a lot worse. That's for sure.
Yeah.
And we looked at some others billing, what I'll call similar companies, or one company in particular that was a competitor to ABS, but I just didn't see the value there. It was more expensive, and I think less value. But this, just speaking to this Facebook group, I mean, often there's so many times that my wife will say, "Oh, I'm not sure about this code," or "Who knows about this?" And we see this all the time. There's a whole exchange of ideas going on in there. People just can get a quick answer from another licensee that says, "Oh, I've dealt with that Medicare issue before. Here's what you do," and that's gold. It really is, because then you are the expert because you're in a group of experts. So even if you don't know, you really are the expert because you're in a group, and
Yeah.
so you have tremendous support. But I mean, from the licensee fee perspective, look, this is the only business I know that you could make your money back in 6 months. And from there, it's all upside.
Well, Daniel, thank you so much for your time. I hope we didn't bother too many people there at the tire store today.
Oh, you might have some new licensees, but I'll hand out cards.
Well, I'm going to answer a few more questions here and wrap this up. Daniel, thanks again for being on here today. This has been very helpful, I'm sure, to a lot of people looking into this business to know whether it's something they could start. And sounds like you have made a success of it already in these short few weeks that you've been a licensee. So thanks again.
Absolutely, it's been a blessing for us. So I'm going to go find my car now.
Okay.
Take care. Okay.
Bye for now. All right, folks, you heard it right there from somebody who's been to the training. Remember, he just went through training last October, and he told me that his first check from this, well, the one they just mentioned earlier that he'd gotten was, almost $5,000. So there's a lot of money to be made in this business, and it's got huge potential. Now, I've mentioned a couple of things here on the webinar today that I want to cover. I mentioned our lifetime training and support, but I also want to talk about our 100% money back guarantee. If you start to get involved with a business opportunity or a franchise out there on the internet nowadays, folks, that doesn't offer a 100% money back guarantee, then you should question why they don't do that. We can do that because we know what we have. And literally in the 26 years we've been doing this, we've only had a handful of people that have asked for their money back. But that's because I don't want you to invest money in something that doesn't seem to have the potential. If for any reason you go through our training and you go, you know what, this is just not what I thought it was going to be, give me my money back, we'll be glad to do that. Now, folks, I'm going to give you the steps that you need to take if you are interested in getting involved in our business. This is real simple. Look over our downloadable research guide. This is over 50 pages of information that you will not find on our website. How do you get this? You ask your ABS business development representative. And if you don't know who that is, then just email us there at the bottom of the screen here. It says info@absystems.com, or call our toll-free number there. And I just realized that that's on there wrong. Sorry. I guess I better pause the screen here and change that, shouldn't I? I've got the phone numbers corrected there. Okay, so browse our YouTube channel. Here it is. It's youtube.com/whyabs. Just go out there and browse and read. There's dozens and dozens of videos that we've got out there. Then ask your ABS rep for an owner reference list. Yeah, that's a list of people's company names, their phone numbers, what time zone they're in, when they started the business, and their interview link if we've done an interview with them. So I would get that list. It's several pages long, and you just ask your ABS rep for that as well. Again, call the number at the bottom of the screen or send an email and just say, hey, who is my business development rep? Then ask for a live demo of our iClaim EMRX platform. I've told you that it's cloud-based, so we can't send you out a CD or anything like that or let you download a piece of software, but we will log on live through the internet to our system and show you step by step all about our software. You can ask all the questions you want, take as much time as you want, folks. We don't try to make this a sales call. We make it an information demo for you. So just ask your ABS development rep for time to do a webinar with you on that. Then review the purchase agreement and funding instructions. We'll send that to you by email, of course. I think you can even download it with a link from your ABS development rep. And you'll see it's just 4 pages long. Very simple agreement that will get you started as quickly as possible. Now, folks, our training sessions do mount up and fill up pretty quickly, especially this time of the year. So be sure and get back with them and tell them you want to get your first training spot locked in. They'll lock it in even though you haven't done the paperwork and so forth, but we'll get that locked in for you, and then you can complete your due diligence and get your funds together.